so we've got two images here, and if you'll notice, one image is sharper than the other, the left-hand side image. If you look above the image, it says 0.2 millimeter focal spot, and on the right, 0.5 millimeters focal spot. There's many technical aspects to a computer or to a cone beam, and those technical aspects determine the better cone beams from those that are maybe not quite as good. Cost is not the issue. They all cost too much. But if you're going to get a good quality image, you need to look at things like focal spot size, number of slices, the voxel size. There are many aspects of cone beam technology you want to look at prior to purchasing. So when the price sounds really good, make sure you're getting the best quality image. Now I know we've got pedodontists, orthodontists, and general dentists in the audience tonight. So what I'm going to do is start with pedodontics. To summarize, what do we use a cone beam for? Every clinical case that we do, whether it's restorative, endo, ortho, pedo, perio, it doesn't matter what type of case it is, we want the diagnosis that's correct. We want to arrive at a reasonable treatment plan for the patient, and that starts with having the correct information. Every aspect of dentistry that I do, I'm a general dentist, I've been doing dentistry for 42 years. And every aspect of dentistry that I do is touched by the cone beam at every age. I think that we enhance our own skills. We improve our clinical judgment, and we will definitely improve our communication with our patients by utilizing a cone beam. The number one patient education tool in my practice is a cone beam, because people get to see their condition, whether it hurts or not. They get to understand what it is they have, and then they can begin asking questions as to what they want to do with that condition. I find it's very easy to engage patients when they can see exactly what it is that I see, as opposed to a two-dimensional image, which sometimes is cloudy or fuzzy or difficult to see, and I'm guessing more than I'm telling. So I feel like the cone beam is applicable in all aspects of dentistry. As far as pedodontics or orthodontics and age of patients, it's still a matter of being accurate in the diagnosis. And if we're accurate in our diagnosis, we will plan our cases well. I'm a believer in early orthodontic treatment, and I believe that early orthodontic treatment can begin as soon as you see tooth position and eruption patterns. So I feel like a cone beam is even more applicable in children than panorexes or other types of radiographic imaging.
I'm actually the CEO of Prosper Dental Products, and we are a dealer in Pennsylvania, just outside of Philadelphia. And we have a lot of choices on cone beams, which cone beams we can sell and which ones we can service. And we decided to choose one cone beam, and it's because of the quality of the image, the quality of the service from the company, and the people that we're working with. So we sell Prexion, the CBCT from Prexion. And why did we choose them? And the reason is because they have one of the smallest focal spots in the industry, as Dr. Julian was discussing earlier in the presentation. And focal spot's important because it really does sharpen the image, especially when you get into larger fields of view. It also has 5 choices of field of view. So if you're an endodontist, then you don't really need a big field of view. You can do just fine with a 5x5. If you're interested in sleep, then you want to take a 15x13. Or if you're just placing implants, then you just take a 10x8. But you have your options where you're not just pigeonholed into one field of view. It also has the longest warranty in the industry that I'm aware of that covers the entire unit and the server. I don't know about you, but I have computers that don't last 10 years. And Prexion actually covers the server and anything with the machine. So that's really important to me and to my customers, because it's peace of mind. For 10 years, you don't have to worry about if a sensor goes out, it costs you $15,000. So that's important. It also says something about the company and how they back their product. One of the things that I do as a dealer, I believe that education is key when implementing new technology. And some doctors get intimidated by going from 2-dimensional treatment planning and diagnosing to 3-dimensional It's almost like they feel like it's a new language, and it's really not that difficult, but education and training are really important in that transition. And nobody does it better than Dr. Julian. He's an amazing educator, and that's what we partnered with him. And anytime our doctors buy a Prexion, after their initial training in the office, we fly them over to the Dental Future Center in Philadelphia, and then you take a full-day course with Dr. Julian, and we have a blast. We take scans on each other, on other doctors in the room, and that gets really fun when we have, 25 doctors trying to diagnose one doctor in the room. It gets a lot of fun. So, but we show you how to go through a case and diagnose a case within 5 minutes. So we pick up all those any fees and your flight, your hotel, all that. That's part of the package. You also get trained in the office, so we train your staff and yourself for 2 days in the office. And there's no need to upgrade your CPUs in your office. It comes with its own server, so there's no need to upgrade, and there's no licensing fees. It's just one price, and you're done. And that's the reasons that I like Prexion, and they're also really known for their service. If something is wrong with the software, they go remotely into your server and they fix it on the spot. They take control of your server. If it's a hardware-related issue, they have a policy that they have someone at your office within 24 hours. And that's service to me. So that's important to me. Also, we have if you want to visit my website, it's prosperdentalproducts.com. One of the things I like about this is I have tons of images. So if you go up here and click CBCT images, you can see all the different fields of view, and then you could see the image quality, and that's important. Most important, even more important than that, is our customer testimonials. I have several testimonials from doctors from all over the country. You're more than welcome to call them and ask them. They're not paid by me. They love the product, and they put a testimonial on there for you. So feel free to contact them. If you go to dentalfuturecenter.com, that's our education center, beautiful center here in Fort Washington, Pennsylvania. You can see all of the courses that we have. We have airway courses. We have comprehensive treatment courses with Dr. Julian. Our next one is June 21st. If any of you are interested, give me a call and I'll find a way to get you over here. So we have tons of courses. Visit our website and you can get updated on updates on future courses. So I had a question earlier, and this is more for Dr. Julian. When you're looking at other cone beams, what is probably the number one feature that you look for one over another cone beam? I had that question today right before we got on, actually, and I think our doctor is on the participant. But what's the most important thing to you, basically, Dr. Julian?
Well, I think there's probably three very important qualities. The first is image quality. I had a recent experience where I went into an office that they used to have a cone beam, and one of the doctors that worked there had a tooth he had a question about. And the cone beam image they had on file from the previous cone beam, he could not make a decision about what to do. They just placed the Prexion in, and we found out that he could self-diagnose treatment plan very easily because of the image quality. So I think if you can see it crisply, clearly, that's probably the most important thing. The second thing is the ability to use the software. So the software has got to be intuitive. It's got to be easy to manipulate and to learn. And then finally, the company itself. In 12 years of owning a cone beam, I've had one issue where I actually had to have a technician come to my office, and they were there within 24 hours. So I think the company has a very good quality image. I think the company has created a software that's unique and different among the cone beam manufacturers. And then as a company goes, I have had no questions or problems in 12 years working with them, and I can wholeheartedly recommend them.